Our population's aging, but we don't seem to have a plan or a funding plan for long-term care for seniors. What's your party's plan to address this issue? I'm going to start with Sue, because she was the last at the beginning, and we'll go down the table.
Absolutely, we need more long-term care beds. I think you'll probably hear a lot of agreement between all the parties on this. It's very expensive to house seniors in acute care beds in the hospitals. It costs up to $3,000 per day. And we believe that we should be doing a lot more to support seniors in either long-term care or home care. And again, I think you'll see some unanimity between the parties on this. The issue is, why are we not actually implementing these ideas? If we all agree, why can't we just move forward? And I think we should do more to help our seniors. Thank you.
Thank you, Sue. As I mentioned in my comments earlier, when I speak to the number of seniors in this constituency, one of the things that we've looked at is over 5,000 new continuing care beds over the next 5 years. But it's really critical to talk about the aging in place concept, making sure couples stay together, that care comes to the couple, not the couple having to chase the care. The other thing we're doing is increasing home care funding. It's very important. We have been increasing it the last couple of years. This last budget we did even more. When I talk to seniors in their homes, they should be able to stay in their homes and enjoy their time with the supports that they need from our system. So it's something we're very concerned about as well. And when you talk about relating to this to the elder abuse strategy and making sure people are safe in their homes, and that's very important as well.
All these policies and things are extremely difficult to discuss in 60 seconds or less. We're talking about a $41 billion budget. The Wildrose plan, specifically on seniors, is we're not looking to cut our budget, cut the budget. We think there's savings to be had. There's no cuts to healthcare. There's no cuts to seniors issues. We think there's efficiencies to be gained and better delivery of services for those same dollars that we've already got committed.
Well, thank you. Healthcare, long-term care right now in Alberta is a major problem. It's a disaster. We have seniors in the acute care beds, as Sue pointed out, and very expensive beds. The thing is, it's not the appropriate care for them, and there's no place for them to go. So we really have to quickly, and we're talking about putting 1,500 new beds, new long-term care beds immediately, and then we're going to have to keep it up because we have an aging population. And we need not just token amounts for our home care. We're talking about 100 million. We've got thousands of seniors that are saying, I'm not going to be able to stay in my home if I don't get some help here. So this is money well spent. It's not wasted. It would probably save us money over the long haul because those expensive beds would open up where we need them. Thank you.
You know, this is a huge issue, and I appreciate the question because home care and long-term care facilities, home care needs to be, the funding needs to be increased, double. But the real problem with both home care and long-term care facilities is the increasing privatization of so many of home care and also of long-term care facilities. And that's it. The Progressive Conservative government seems to want to just subsidize private for-profit organizations to provide that service, but that drives up the cost. And you know, I'm really worried in terms of the future. I mean, personally, and I'm with you on this, that I won't be able to afford most of the choices that we have in terms of long-term care facilities, and that's a real concern. So I think I would, along with Ray, I'm sure, really promote publicly funded and publicly delivered home care and long-term care facilities, which we don't see enough of in this province.